available to folks after the presentation here. Okay, so back to the biography. Dr. Jagne presently works as a Senior Extension Associate and head of the Avian Health Program at Cornell University Veterinary College's Animal Health Diagnostic Lab. She has over 26 years of experience in poultry disease management and control. She translates and interprets poultry test data for veterinary practitioners and poultry producers, as well as providing on-farm technical assistance to commercial and small farm poultry owners. She also develops new diagnostic tests for poultry disease in collaboration with the Diagnostic Lab colleagues. She has an extensive international veterinary background, leading an avian influenza project for the United States Agency for International Development, and working as a veterinary diagnostician with the Food and Agriculture Organization of the United Nations in Rome, Italy. She's also worked as a technical services manager for ISA Babcock, a large poultry genetics company. She holds a DVM from Cornell University and a Bachelor of Science in Biology from Colorado State University. Dr. Jagne completed a 2-year postgraduate residency in avian disease and pathology at the University of Pennsylvania and is a diplomat of the American College of Poultry Veterinarians. And with that, I'll give the floor to Dr. Jarra.
Okay, thank you. Can you hear me very well?
Yep, you're good.
Okay. So I have a lot of slides that I am going to give to Amy afterwards to help you. I'm not going to go through all the slides because we only have about 45 minutes, so you can ask questions. But just for your own use, you know, I've added a lot of information. So we're going to be talking about internal and external parasites of poultry. And the most important of these internal parasites is coccidiosis. I get more questions and we see more cases of coccidiosis than any other parasite. So coccidiosis is a protozoal disease, and it primarily affects the intestinal tract and causes destruction of the blood vessels in the intestines. So it's always accompanied by bloody diarrhea. So, and the birds usually are very depressed. In chickens and turkeys, it's caused by an organism called Eimeria. And in chickens, we have 9 of those Eimeria. And they tend to be very host specific. The coccidia that affect chickens do not affect turkeys. The ones that affect turkeys do not affect quail. So they're very species specific. And we usually see the clinical signs of coccidiosis around 4 to 16 weeks of age. If I see coccidiosis in a chick, that's about maybe 1 to 4 days, that's very rare. That must be a heavy load of coccidiosis around those chicks, but it's usually seen in 4-week-old birds or up to 16 weeks. After 16 weeks also, whenever people call me and tell me they have an adult chicken that has coccidiosis, I usually say, no, that's impossible. It's very rare to see an adult chicken like about a year old, unless they're immunocompromised. And their eggs are called oocysts, and the oocysts are very resistant to environmental conditions. So they can be in the environment for a very long time. They have a very direct life cycle, but it's also very complex. So just showing you that what usually happens is the eggs come out of the feces and they look like they are sporulated, and they start dividing, and then the chicken picks them up. That's basically it. But once it gets into the chicken, that's where it becomes very complex. As you can see, all these different stages, they undergo different stages, and this is all happening in the epithelium of the intestine, in the lining of the intestine. So we have 9 species in chickens. The ones that are very pathogenic cause very severe bleeding of the blood vessels in the intestine. And so with coccidiosis, we always see diarrhea, And the diarrhea is followed usually by depression, weakness, and anemia. And there are risk factors for coccidiosis. If you have a chicken house that's constantly wet, there are too many birds, and the conditions are just not clean, then you can have coccidiosis showing up in that flock. Wet bedding, we usually see it also mostly in the summer months and in the fall. The summer months, because it's really humid, and some of these poultry houses can have very high humidity and condensation. And so these oocysts will thrive. So I just talked about this. They become infected when they eat the oocysts. And how is it transmitted? I mean, people can walk in with the oocysts on their shoes. Dust can carry the oocysts. Equipment, when people share equipment, can cause the cocci to spread. The specific clinical signs, we have a lot of deaths, especially the younger they are, the higher the mortality. The mucoid or bloody diarrhea, they're very dehydrated. They have these ruffled feathers. They don't gain a lot of weight, especially when you're dealing with broilers. Broilers are supposed to be gaining weight so that the people that are raising them can send them to market, but with coccidiosis, they don't gain weight. And some breeds will lose the pigmentation. Like, for example, a lot of the Cornish hens have yellow colored legs, and they will lose that pigmentation. They're getting that from the diet, but they will lose it when they have the diarrhea. So this is what chickens look like when they have coccidiosis. And you can see the ruffled feathers. They don't look really happy. They kind of have their eyes closed, they're weak. And I always have to show these because most of the time when we see coccidiosis is because they're bringing us a dead bird. And I am also a pathologist, a poultry pathologist. So we always open up dead birds to look for these lesions that would tell us definitely that we're dealing with cocci. So this is a type of cocci. It's called Acevolina. I'm not going to spend too much time with the different types, except for the one that's more common, that is what most people see. So with the Acevolina, it's in the middle part of the intestine. You can already see these whitish areas in the intestine that when we open up, you can see they're just these striations. We, in the lab, we usually see these types of coccidia, but most farmers usually will see the Eimeria. Some of them are very pathogenic, like this one, which is the Nicatrix. You can even see from the surface of the intestine, you can see the blood spots here, hemorrhagic spots. And when you open these intestines, look at the blood. It's all filled with blood. So these organisms, there's a lot of them that have invaded the intestine and just destroyed all the blood vessels. And the Tenella is one of the most pathogenic ones, and it's the one that is most commonly seen, especially in backyard poultry. And it causes severe inflammation in the cecum because that's where it's found. So the nice thing about Eimeria, the organism that causes cocci, is the specific types will invade a specific type of the intestine. So just looking at the location of the lesion will tell us what type of Eimeria it is. Usually we have to send it to the lab for confirmation, to the parasitology lab, but usually if I see Eimeria in the ceca, I know it's Tenella. So later on, after the bloody diarrhea, then usually a lot of the destruction of the intestine shows up as this cheesy cecal core in the cecum. So Tenella causes really high mortality and morbidity in chickens. It's like when it gets into a flock, all of them become infected, and a high percentage of them will die. So this is the Tenella. So you can see the swelling of the ceca. The ceca comes out of the large intestine of the chicken, So you can see here again, blood, and that's a normal cecal content. I usually encourage people that own chickens to at least learn how to do a little necropsy. If you don't know what you're seeing, call me. Now we have, if you have an iPhone, I have an iPhone. I've done that a lot with many of my clients, and we can FaceTime, and I will tell you to open up the ceca, and we can take a look. If you're far away and you can bring your birds, that's always a good idea to learn how to open them up and look at the different organs, especially those of you that work with the Cornell Cooperative Extension. I think one of these days we'll probably have a class on necropsy for the county educators. So you can see what happens when, as the disease goes further, instead of the blood, you just see this cheesy material inside the ceca. And that doesn't mean that the birds are getting better. Usually by this time, they'll probably be dying. So we do fecal flotation, examine and look for oocysts, and these are the oocysts. These are the eggs of the coccidia. So how do we control coccidia? There are some high-risk things I told you about, and that's high moisture. So you want to have a dry litter. That litter has to be managed so that it's never wet. Never wet from humidity, never wet from spilling or spillage of water. So that's why some of these bell drinkers are not very good, because when the birds hit them, you will have a lot of water. So it's better to use nipple drinkers. So proper ventilation is good, so you don't have the condensation inside the coops. Managing the bell drinkers, the waterers. Again, I recommend the nipple drinkers. Now I've included some treatments, preventive doses of Amprol. Amprolium or Corate is the #1 medication that's used for preventing and treating coccidiosis. Sometimes I get this question from people. They said, oh, I want to raise my birds organic. I can't give them medicated feed. No, medicated feed is not a feed that contains antibiotics. It's a feed that contains coccidiostats. And the organic boards are not classifying coccidiostats as antibiotics. So you can still use the medicated feed, especially for the first 12 weeks at least. Use Amprol in the feed or use it in the water for your birds to protect them from coccidiosis. So when you're using it as a prevention, you can use either the 20% soluble powder or the 9.6% solution, and you add 1 fluid ounce to 2.5 gallons. So it's better to use it at least for the first 12 weeks. Or if it's in the feed, you don't have to even worry about this. Just buy the feed, that medicated feed. Now, when they break out with coccidiosis, you can use this same dosage, but give it to them for 5 days in the drinking water. And the other medications that we use for coccidiosis are sulfur drugs. So sulfadimethoxin, sulfaquinoxylin, and sulfamethazine are very common. We used to have them at the Agway or Tractor Supply, but they are classified as antibiotics, so they've been taken off the shelf, so you need a prescription to get those. So sometimes we try to control coccidiosis by natural exposure. If you just give birds small amounts of oocysts, they will develop immunity. It will not make them sick. So the exposure has to be done very carefully. It has to be moderate, because if it's too much, then they will get sick. So I just want to talk a little bit about necrotic enteritis. Necrotic enteritis usually follows coccidiosis. It's a bacterial infection, but we always see it together with coccidiosis. And it's just an opportunistic infection by Clostridium perfringens that produces toxins. So it also causes very high mortality. And, always has to have a coccidia with it. So when you're treating for coccidiosis, if you have necrotic enteritis, you have to also use antibiotics like bacitracin or penicillin. So I just wanted to show you a photo of what the intestine looks like. This is after coccidiosis with all the bleeding and so on. You just have this necrotic intestine. So it causes very high mortality. So that's it for coccidiosis. Do we have any questions? Okay, I'll continue. We have the internal parasites now. The most common of the internal parasites are the ones that we call the helminth parasites. Chickens can be infected by a wide variety of helminths. And helminths are usually, we call them nematodes, the most important ones. They're the largest and the most, I would say, they are the ones that cause the most disease. So we see a lot of helminths in free-range birds because they are coming into contact with the intermediate hosts of these intestinal worms. So we don't usually see helminthiasis in large commercial farms, especially if they're caged, because they cannot get at their feces. So it's all part of the life cycle that these parasites have their eggs in the feces, and then when their feces are on the ground, you have other chickens coming and pecking at the ground, or you have the numerous intermediate hosts like earthworms and beetles, and the chickens will eat those. And while they're eating those, they're also eating the eggs from these parasites. So flies also are very good at transferring these eggs. You know, sometimes if there's a huge fly problem on a large farm, then you will see the helminth outbreaks. But what we are seeing now is the helminths are showing up in organic farms, because with the organic farms, the birds are on the floor. So they have access to their feces. As long as they don't have access to their feces, they will not have these parasites. So doing organic that's one of the disadvantages of doing organic farming, is that you have to deal with trying to control all these helminths. So one of the common nematodes that we see, especially in game birds, is the nematode of the respiratory tract called Syngamus trachea. There's one that affects geese that we don't see much, but the one that affects chickens and game birds, especially guinea fowl, quail, that's Syngamus. And it is in the trachea. And if there's tons of them in the trachea, they block the trachea and suffocate the bird. That's how they die very quickly from it. And then you have the hosts, such as snails and slugs and earthworms, that can keep the eggs of these parasite for many, many, many years. So if you have a lot of snails and slugs in your coop environment, the chances that your chickens might get Syngamus is really high. But so far, I have not seen a lot of chickens that have had it. I've seen it more in our pheasants, quail, and other kinds of game birds. So it also causes, in addition to blocking the trachea, it can cause poor conditioning, and of course the high mortality associated with the suffocation. So the eggs that have the L3 stage of the larva are the most infective. So here is a chicken gaping. And when we open up that chicken, this is what we found. This is the gapeworm. This is the male and the female. The male is smaller than the female, but they're always in permanent copulation. So you always see them attached. You will never see them separate. Here is one where we have tons of them. and this will cause a blockage of the trachea, so the birds will not be able to breathe. So you have to rule out other things like infectious laryngotracheitis that can cause suffocation and wet pox also. But it's a life cycle that can either be direct, the feces come out, you have the eggs, and then you have a larva, an infective larva in the egg, can go straight back into the mouth of the bird. So that's the direct cycle. And then you have the indirect one, where you have the intermediate host picking up that infected larva. So the only way to prevent and control this is to make sure that everything is nice and clean, and trying to break the life cycle usually is more effective than using drugs. But I would talk about in general about the kind of drugs that we have, because we have the Food and Drug Administration that doesn't have a lot of drugs approved for poultry. So we are constantly battling that lack of medication. In some of the pheasant farms, they will do what we call confinement rearing. So they rear them indoors before they leave them to go outside. And then some people get desperate and they try to treat the soil with the chemicals like carbaryl so that they can kill the intermediate host. It's not difficult. It's not hard to. It's very hard to to kill earthworms. You can see them when it rains. You see earthworms everywhere. So it's really hard to kill that type of an intermediate host. So later on, I will talk about the treatment for all of these worms. But we have the main nematodes that we really deal with. One that's called Capillaria. It causes a lot of disease, and the birds can have very high mortality. Then we have Heterachis, which is also called the sickle worm, and then the ascarids. The ascarids are the largest of the nematodes. Those are the normal roundworms that you will see whenever you open a bird that has been free range. They never lack these worms. So, but they need to be kept under control. Otherwise, if you have too many of them, then it can cause mortality in chickens. So the Capillaria are also called threadworms because they are very, very small, but they can be very pathogenic. We see them a lot in the crop of the bird, where they cause bleeding, they cause anemia. There's a lot of thickening of the crop mucosa. So there are many different types of Capillaria, but the most common one that we see is the C. annulata, which causes the thickening in the crop. There's another one that we see in the lower intestine. So when we have capillary infestations, we usually see poor growth in the bird, drops in egg production, and drops in fertility. And when you open them up, you see very severe inflammation in the intestines and other parts of the digestive tract. It's always good to put in preventive measures for the control of parasites. Don't depend on drugs. The drugs can be added to whatever you're doing to try and control them. And the best control is to make sure that things are clean. You don't have too much feces in the coop, for example. Don't let the fecal material pile up. And for game birds, the best way to control parasites is to raise them on wire so that they don't have access to their feces. And if you can control the intermediate hosts, if they're present in the life cycle, that's a good idea also. So Capillaria, very, very small worm of the digestive tract, starting all the way from the crop into the intestines. Then we have the sickle worms. Now the sickle worms are important more for another disease that they carry than for affecting the health of the bird. So They just sit there at the end of the ceca, the same ceca that I just showed you that we see in coccidiosis. That's where you find these cecal worms. I always look for them. They're really, really tiny. Whenever I do necropsy, I usually will snip off the top of the ceca to look for cecal worms. But their main importance is they carry another intestinal protozoan disease, histomoniasis. Histomonas meleagrides is a protozoan, just like coccidia, but it causes what we call histomoniasis or blackhead. And that affects turkeys mostly. Turkeys are extremely susceptible to blackhead, while chickens are very resistant. So that's why we say don't mix chickens and turkeys, because the chickens, for the most part, will have cecal worms carrying this histomonas, and in their feces, they're releasing the eggs of this histomonas, or even the cecal worms themselves, when they're picked up by the bird, can then start this process of the eggs being released and then the histomonas being released in the intestines, causing damage. So the life cycle of the cecal worm is very similar to the large common roundworm, and but their eggs are very resistant. All these parasites have very resistant eggs that can survive in the environment for a very long time. So this is what the cecal worm does. It carries the histomonas in the ceca, but when you're raising chickens and turkeys, the chickens will have a lot of heterakis, or they will be releasing in their feces the eggs from the histomonas. And this is what you get: blackhead, histomoniasis. Look at how thick the ceca of this bird is. And this is the classic necrosis that we see in the liver. So these birds just die. I mean, I've had cases of turkeys where over 50% of the flock was lost, like just before Thanksgiving, due to histomoniasis. So that's why these cecal worms are important. So you have to treat and eliminate the worms to prevent histomoniasis. We used to have histomoniasis drugs, but they were banned by the FDA. So I will talk later about fenbendazole. So that's what we are going to be treating with, and trying to also keep turkeys and chickens separate. That's the first preventive measure. And then the large roundworms are the ascarids, and it's called Ascarida galli. They occur in both chickens and turkeys, and the adult worms are quite long, between 1.5 to 3 inches long. And you can see them with the naked eye. Some of these worms, like the cecal worm, you have to really maybe sometimes look for a magnifying glass to see them. But with the ascarids, they're huge. So sometimes they wander around the intestine and come out, hopefully wanting to come out through with the feces, but sometimes they get into the oviduct where the eggs are being made, where you have the yolk sitting, waiting with the albumin around it, waiting for the eggshell to be put in, and then these worms will just wander and get into the egg. And from time to time, we do get those complaints. People find worms in eggs. So it's not a common occurrence, but when it happens, especially if it's for people that are selling eggs, it's a big PR problem. So the life history of these ascarids is also very simple and direct, and but their embryonated eggs can survive in lab conditions for 2 years, and they can survive for about a year outside. So always worry about the environment when it comes to parasites. So when they have ascarids, they get very thin. They become very emaciated here. You can see the prominent keel bone. Then they have diarrhea. So whenever you have chickens that have diarrhea, number one thing that you think about is parasites. So they get a little bit droopy, and especially if it's a heavy load. Sometimes it's just a mild load and you won't notice it, but if it's a heavy load, you will. And this is a really bad case of ascarids that blocked the intestine and caused decreased egg production. And it also has a direct life cycle, but the life cycle is kind of long. It's 28 days. But you can see they're long roundworms. And this is what I was talking about. You break an egg and then you find a roundworm in an egg. And it's not that it happens every day, but from time to time, I was sent a photo. At one time, someone sent me a photo with the worm that had been boiled in the egg. So it's a more of a PR problem than anything, but we're seeing it a lot more because now there's a lot of organic flocks that are raised on the floor. So in the old days when more birds were in cages, we didn't have any problems with parasites because you have to have a really high load to have a parasite leave the intestines and wander into the oviduct. So this was a case somewhere near Albany. We had these chickens brought here to our lab and we couldn't find anything. And then they kept calling and saying that their chickens were dying. So I went out there and saw some of the ones that looked really sick and some ones that had died. So we opened them up and this is what we saw. Very heavy infestation, but it was a very wet summer that year. There was a lot of water logging. The area where they had the chickens was not well drained. They had them in this like small Quonset huts, and there was a lot of fecal material there. There's a lot of fecal material all around where the chickens were free ranging. So they were just picking up this grass with the fecal material, and it was just cycling in them, and it produced a lot of worms and a lot of eggs, and then it goes back out and cycles again. So they eventually had to get rid of these chickens because they were selling the eggs at a farmer's market for a lot. So it happens. We see them. You know, it's also just as common, I would say, as coccidiosis. Coccidiosis is number one, but then these internal parasites also. So there are some drugs that are available, and that's what I'll be talking about later. Strict sanitation is the control method of choice. Cleaning and disinfecting before you bring new birds, and in fact, segregating birds by age, because younger birds are more prone to getting parasites, and it will kill them more than it will kill an older bird. So what drugs do we have to control roundworms, all kinds of roundworms, from Syngamus, the respiratory tract worm, to Capillaria, and to the large ascarids. We only have one FDA-approved drug. It's called fenbendazole. Fenbendazole is also called Safeguard. And to help our clients, I usually recommend that they use the liquid dewormer for goats. It's available at all the feed stores. It's called Safeguard 10% liquid dewormer for goats. So all you do is add it to the drinking water at 3 ml per gallon for 3 days. Then you repeat again in another 10 days, but the eggs have to be withdrawn for 17 days. So that's the only downside, is that it has this long egg withdrawal. So then you have the equine dewormer that's called Panacur or Safeguard Equine Dewormer. That's a paste. So you can squeeze out just a pea size and put it in their mouth. Then again, you repeat it in 10 days, the same thing. Now, there's another one that is not FDA approved, but we can use it what we call off-label, and it will still be legal to use. So albendazole is also called valbazen, and it can be given orally. So you can just take it, a 1/4 ml for a small chicken like a bantam, or 0.5 ml for a regular size chicken. And then that one you have to repeat in 2 weeks, and the withdrawal is 14 days. So we used to have another drug called Wazin, but Wazin was pulled off the shelves because the manufacturers did not want to go through the hoops for the FDA to establish it, to establish the withdrawal period. So they just decided they were not going to make it anymore. So that's all we have now is fenbendazole or Safeguard. At least you can get this for cheap, because if you go online to try and get fenbendazole to treat your flock, they sell them in large quantities for hundreds of dollars. But I have not asked how much this costs, but it's a lot less. So many of my clients really like it, the goat dewormer. They are not making any preparations for small flocks. They have the big gallon jugs for large flocks, large commercial flocks. So this is the best we can do when it comes to the small flocks, is to either use this liquid dewormer or to use the equine one or to use the albendazole. So what about tapeworms? I don't usually worry about tapeworms. Tapeworms don't usually cause disease unless there's tons of them, which is very rare. But they are the flattened type of worms that look like a tape measure. That's why they call them tapeworms. And they have different sizes. There are some that are very small and some that are really big and long. Sometimes you have to really look hard to find the small ones. And they don't really bother the bird. They just sit there and just share the food. But if there's a lot of them, then they share too much food. And then birds can get weak, and then they can have all the things that you might have when they are nutritionally deficient. Now, most of these cestos spend their life cycle in an intermediate host, and there are many different types of intermediate hosts, and they can also be controlled by using fenbendazole. Levamisole is one of the other ones that if you have it, you can use it off-label, but it's not as readily available in the US. We see it more in Europe. But trying to eliminate the intermediate host is a lot better method of control than using the drugs. So make sure that in the environment, you don't have a lot of beetles and grasshoppers and house flies. So these are just showing you what the cestos look like. You can see they're tape-like, and sometimes they cut off and they become what they call proglottids. And sometimes that's what people see in the feces. They call me up and say, oh, I see these little things that look like rice in my chicken feces. And it's usually the reproductive portions of the tapeworm falling off into the feces. So they're really tiny, round, seed-looking things in the feces. So for treatment, I've talked about fenbendazole, but it might be good to always check with a vet or check the Food and Drug Administration website. They update this all the time. There are not many dewormers that are left around for us to use. And most of them, you see, I'm using them extra label. For example, valbazin is not approved by the FDA, but we're allowed to use it extra label. So get the advice of a vet when it comes to using drugs for treating nematodes. So the last part are the external parasites. And these are the lice. We have chewing lice and blood-sucking lice. The blood-sucking lice usually only attack mammals, and the chewing lice affect the mammals and birds. So these are the most common lice that we see here in North America. This is called Minopon gallinae, and we have the other one, the M. straminius. So they have a preference for certain body parts, and the Menacanthus straminius, usually you will find on the skin, eating the skin scales, and sometimes chewing through the skin and puncturing the feathers. We call louse infestation, we call it pediculosis, and usually can accompany dirty environments and very poor management of chickens. Lice are species specific. The lice that affect chickens are not the same as the lice that affect goats or sheep or other animals. So these are the two most important species that we see, Menacanthus and Menopon. And they spend the entire life cycle on their host. And when the host dies, they also get off, they disappear. So, but we do see that they leave telltale signs. They can leave their eggs, even if you don't see them, even when the bird is alive, and you say, oh, I'm going to look for inspect my birds and see if they have lice. You will not see the lice sometimes, depending on the life cycle, but you will see the eggs. So they lay the eggs at the base of the feather and attach it with this glue-like substance. So those eggs are called nits, and they hatch within a week into nymphs. And the nymphs look just like the adult lice, except they're smaller and look transparent. But one female louse can lay 300 nits in one life cycle. So can you imagine if your chicken has about 1,000 lice on it, how many nits they can produce and how many new lice they can produce. So it's a problem that has to be nipped in the bud, definitely. If you don't do that, you get into real trouble. And the worst are the mites. I will talk about them after this. But the lice are usually spread from chicken to chicken because they will crawl from bird to bird, or sometimes the feathers have the nits, especially when they're molting. And it's usually worse in the fall and the winter months. I think it's because they close up all those chicken houses, trying to get the birds warm. And then the birds are confined, they're not going out much. And then the lice just explode. So when you see chickens always preening and scratching, and there's poor weight gain, low egg production, examine your birds. If you see feather loss and some irritation, especially around the vent, check the birds. Because with very severe infestations of lice, you can get some mortality. Let me quickly finish so that we can have time for questions. Always examine the vent and look at the base of the feather to look for moving lice or look for the eggs. Here, I'm showing you, these are the eggs. They look like little grains of salt or sugar, but you always see them here at the bottom where the feather enters the skin. Now, if it's a really bad infestation, you will see them laying the eggs all along the vein here of the feather. So those are the ones I call Rastafari chickens, because they have a lot of clumping of the feathers and it's just like eggs. So I've seen some really bad cases. So this was a case that came to Cornell here, and you can see the eggs here, even in these small feathers. They're being laid in the small feathers. So these birds had both Merex and lice infestation. Now, what I noticed also is when chickens are debilitated by disease, you also get the lice attacking that chicken because they cannot preen properly, they're weak. So we tend to see the birds that come in here for necropsy. Sometimes you open up a bag and you will find lice on the chicken, especially if it's a fresh dead bird. Here you can see again the lice on the feathers and then the eggs or nits at the base. So mites. Now mites are worse than lice. I can deal with lice, but mites, oh my God. They are tiny, first of all. Some of them, you can see them during the day because they're hiding and they come out at night to feed. They are not host specific and they adapt very well to changing environments. You will find them in your house. If you have a tree near your house that has wild birds and the wild birds leave the nest, sometimes those mites there will come into your house. So they have these little mouths that are designed for piercing and chewing, and they cause anemia because they feed on blood. So they spend a lot of their time off of the bird. They just go in to feed and then they go back out into the crevices, hiding, especially if there's a lot of wood in the coop. So wild birds carry a lot of these mites. So they're very important in mite infestation. So they have a life cycle that consists of the egg, larva, nymph, and mature adult. So they go through 4 different stages. And in 1 week, they can complete the life cycle. So the adult female needs blood to reproduce. So 95% of mite populations are female. So to keep the mites going, they have to basically eliminate males. And they usually are opaque when you first see them, but once they have a blood meal, they become red. So in North America here, we have the northern fowl mite and the chicken red mite are the most common. And I've seen a lot of scaly leg mite also. And again, it's very similar, the clinical signs, to what we see with the lice. They can have weight loss because they spend too much time preening, trying to get these parasites off. But in addition, with the mites, you do have pale combs due to the anemia. They're feeding on the blood. Then their feathers are stained with this excrement or debris. And that's how usually, especially in white-collared birds, that we know that they have mites. They've been known to transmit diseases like fowlpox, Newcastle, and they can survive up to even 4 weeks away from the host without needing a blood meal. So some of them, this northern fowl mite, you can see it both during the day and night. It's not like the red mite. So you can go in during the day in the coop, and sometimes you'll even see them on the eggs. So this is just a photo of a mature adult. And this is what I was talking about. Like, this is a white colored chicken, and this is all debris. So always look at the vent area. If you see this dark powdery stuff, that means that these birds have mites. Here you can see some inflammation, and again, some of this debris that they leave behind, the excrement. And I talked about them having anemia. They lay their eggs in the crevices and cracks, and then they come out. This is the red mite. This is the worse than the northern fowl mite because it causes very severe anemia and causes death in very young birds. So this was a case that came here. This lady was complaining about the hen losing a lot of feathers, and I couldn't see any mites on the chicken. I couldn't see any excrement, but I told them to go in the evening and take a look, and they found the mites. When they went in the evening at dusk with a flashlight, they found some mites on these chickens. So it had lost a lot of feathers, and you can see how red these areas are. That's just the inflammation from the mites biting them. And this is what I was talking about. They look gray before they feed, and then they look red after. And these are the little eggs that they lay in the crevices of wood. So with mites, again, the only FDA approved chemical we have is permethrin. Permethrin is spray or dust that we use for our vegetables. It's just a chemical form of chrysanthemums. Some people use diatomaceous earth, but that's debatable because we haven't seen any research that shows that it's effective. But if you do a treat, make sure you repeat it every 2 weeks until you no longer find the lice or the mites. So it's the same treatment for both lice and mite. You just use a dust or spray. There are other products that have come out. There's one called Spinosad. Those are a lot more, I would say, toxic to people and to birds. So you have to really follow the directions, the manufacturer's directions. But I always recommend permethrins because they're very, very safe, and you can either use it as a spray or dust. And this is what I found at the local agway, permethrin, garden and poultry dust. So it's also used to get rid of those insects that follow the tomatoes and some of the other plants that we have during the summer. So it's very safe for humans. So scaly leg mites are really tiny. They live in the unfeathered skin of the leg and feet, and they burrow under the skin, so they elevate those scales, and this is what we get. So I'm sure you've seen some older roosters, especially with scaly leg mites. They're very difficult to see. All you see is one day your chickens are walking around with their feet like this. So that's why it's always good to do preventive measures. Make sure you are checking your birds. Make sure that you're using dust at least once every season. If you can't use it once every season, use it in the summer, in the fall, and in the spring, so that you might keep them off of the chickens. Now, ivermectin is very effective. It's not FDA approved. If you go to the FDA website, it will actually tell you not to use ivermectin, but we use it off label. It's extremely good, and I will tell you the dosages later. But with scaly leg mite, you can also coat the legs with petroleum jelly to suffocate the mites. There's a traditional treatment that people use, mixing 1 part kerosene to 2 part linseed oil. And but ivermectin, there are different types. There's an injectable one. You can give it in the water. You put 7.5 mL per gallon for feed it to them for 1 day, and then you skip 10 days and repeat it. And then you can also give it directly in the mouth, 0.25 mL for a large hen and 0.1 mL for a small one. Now there's one that's called a pour-on for cattle. Now do not give that orally. You should not give that in the mouth. It should not be taken internally. It's meant for the skin. So for small birds, use 2 to 3 drops using a dropper. Medium birds, 4 to 5 drops, and large roosters use 6 drops. But the egg withdrawal for ivermectin is really long. It's 20 days. So thank you, and I'll take any questions that you may have.
That was excellent, Dr. Jagne. Thank you so much. And as was mentioned in the chat and before we started, all of these slides are going to be available to you, as well as the recording following me getting it buffered and edited and sent out. So in the next couple of days here. But in the meantime, we do have a couple of questions that came in the chat box. So the first is, what is the name of the treatment for the soil? And I believe that this question is in relation to the molluscicides that you'd mentioned.
Oh, the insecticide?
Yeah.
Yeah, it's Carbaryl. Carbaryl. I usually don't like to talk about Carbaryl and 7 because they are not allowed by the FDA anymore. So those are they were older types of insecticides, and the FDA does not want us using them in chickens. And soil treatment is really difficult. So it's better to manage birds so that there's not a lot of feces. It's the feces that's carrying a lot of these eggs, of these parasites. So as long as the feces don't pile up, you might not have a parasite problem. But I always tell people, you know what? They always say, oh, maybe I should do a fecal. I don't think it's important to do a fecal. Any chicken that goes outside has worms. They pick up everything. So what you need to do is to deworm them regularly throughout the year. I think once every season is fine. But if you want to take out a season, you can take out the winter and deworm them in the spring, in the summer, and in the fall. And that will help. And ivermectin is very, very effective. I know some people that use ivermectin and they've never had any problems with parasites, whether it's internal or external.
Great. And then as a follow-up question, so there are some flea sprays for dogs and cats that contain pyrethrins. Can these be used on chickens?
I usually say no. Pyrethrins and permethrins are very similar. I know there are some flea preparations for dogs that are very toxic. Not the ones that have the pyrethrins, but there are some chemicals. I think I can't remember the last one that came out for dogs. And someone tried and used that on a chicken, and the chickens had neurological signs. So if it says it's a flea spray for dogs and cats, please just go to the agway and get your permethrin dust.
Okay, great. And so a lot of these treatments that you've been talking about, are they in regards to laying hens, or can we use those for meat chickens too?
Well, they can be used for meat chickens, but you have to talk to someone like me to give you the details, because the meat chickens and the egg layers, because most people keep egg layers as small flocks. That's why I usually concentrate on egg layers. But if you're keeping meat chickens, get a good recommendation from a vet or from like a university like Cornell. You talk to the avian health person, because the withdrawal time is usually different. But you'll be surprised to learn that sometimes the withdrawal time for meat chickens is a lot shorter than the withdrawal time for eggs. So a lot of these, like for example, the fenbendazole is zero withdrawal. You really don't need to observe any withdrawal. You can feed it to them today and slaughter your birds tomorrow.
Right, great. And so on the line of withdrawals here, so when we talk about egg withdrawal, so like a 20-day withdrawal, for instance, does that mean that the hens won't lay eggs, or does that mean that we shouldn't eat or sell the eggs?
You shouldn't eat or sell the eggs. They'll be laying eggs, of course, but you're going to throw those eggs out. So if you're selling eggs, that's not a good way to take care of the parasites. But permethrins is zero withdrawal.
Perfect. So another person asks, you've talked a lot about pasture chickens being a high risk for parasites. If you rotate those birds frequently around a pasture, does that help reduce a lot of the risk that you're talking about?
Yeah, it does, because then what you're doing is you're spreading the feces elsewhere. It's not going to be in the same place. So, but because that's basically what you need to do. You need to remove the feces to prevent those eggs from being picked up by the chickens. So pasture rotation is fine. I've seen some people have like those, what they call those tractors, chicken tractors, and they just move them from place to place. But you need a lot of land to do that. And so people that have small flocks, like 6 to 8 chickens in their backyard, most of the time they won't be able to do that. So they really need to do this seasonal deworming.
Okay, great. I have a question here about chicken lice. So we talked about mites ending up in your house and on you and all that lovely stuff. Are lice the same way, or are they chicken specific?
No, lice are chicken specific. They're very chicken specific. And if they get off the chicken, they don't usually survive. But mites, oh my, I cannot tell you how many human cases of mite infestation I've gotten calls about. I don't know why they think that I can take care of them, but I should tell them to go find these, what do they call them? The people that come and spray your house. So they call me and they're complaining about mites. And some of them, you know, want to know if there was a lady from New York City, but I think she was kind of an outlier. I mean, she wanted to come to the vet school for us to take care of her mite infestation.
Oh my.
She thought she had mites in her hair.
Oh gosh. Well, I mean, just talking about mites makes me itch.
Yes. So we told her, no, go to your dermatologist. That's where you need to go to. But definitely if you have mites in your house, oh my, they're a big problem.
Yeah, I've also heard that bed bugs can transfer in between people and chickens as well, and back and forth.
Oh, bed bugs?
Yeah, there was an incident at a university within the past 2 years where they had bed bugs that infested the insulation in the building, and some of the employees came home and they took the bed bugs home with them.
Huh.
That's fun.
Yeah. I've seen something here. It says popular bloggers post that brewer's yeast with garlic is good to keep parasites at bay. To tell you the truth, when it comes to parasites, you can forget that organic stuff, because you're getting yourself in trouble if you don't take care, especially mites. Mites can go crazy. I had a client where it took a whole year to control these mites. We would think that we were there, we used ivermectin, we used the dusts, we took the chickens out of the houses, put them elsewhere, brought them back, cleaned all the houses, and the mites were still around. So brewer's yeast with garlic is not going to do a good job. A lot of these things, organic things, have not been proven. Sometimes people just package them and sell them. Of course, you know, there are things that, you know, you can use just for the short term to suffocate a mite. But for long-term treatment and for keeping these mites out of your chicken coop, it's better to use the permethrins and like some of the newer ones like a spinosad. It's also called Elector. And I think all these, you know, you can either get online or you can go to the local feed store. They will have them.
Great. And just a follow-up question to that. So when you're treating for mites, should you treat multiple times to make sure that they're gone?
Not only should you treat multiple times, you should also make sure you clean the house and spray it with the same chemical that you're spraying on the chickens. Because if you just spray it on the chickens or dust the chickens and put them back in, many of these mites, especially the red mites, they're still hiding in the crevices of that chicken house. Any little corner they have, they will hide in there. So you have to really spray them. At least once every 2 weeks, you need to do the treatment. I told you that their life cycle is just about 1 week. So you have to break that life cycle. In the beginning of the treatment, do it every week, maybe for 2-3 times, and then you can do it every 2 weeks. So it's a big headache. I've known people that have just given up and just gotten rid of their chickens and burnt down the chicken coop because they couldn't control the mites.
All right. There is a follow-up about discarding eggs for those that are in withdrawal. And so the question is, do you discard them because of the levels of medication in them?
Yeah.
Yeah.
Because you don't want the residues of ivermectin to be in the egg and then you sell it to people, because we don't know what ivermectin does in humans. Now, some people think it can cure COVID, but that's what we've been facing in the past few weeks. Veterinarians have had people like stealing ivermectin from their veterinary offices to use for COVID treatment. But those are animal ivermectin. It's not made for humans. So they're poisoning themselves. So that's the latest thing I've been seeing is about people using ivermectin. There's a human ivermectin product. Ivermectin is a magical drug. It was used to control river blindness in many countries, especially in West Africa. Lots of communities, you know, children will grow up blind because of the onchocercia. The black fly will lay their eggs on their eyes. And it was because of ivermectin that no one sees river blindness anymore in Africa. But that's a human preparation. So I will urge that you tell your clients or people that you work with not to use animal ivermectin in humans at all.
Okay, great. And then we have a follow-up about mites real quick. What is the best way to dust a chicken?
Okay, the best way I've seen that people do, okay, I like the liquid. If you can get a liquid one and you just spray it on them, then you can really get them really wet. But with the dust, with the powder, you put the powder in a brown paper bag. And if you have maybe like 10 chickens, it's easy to do that. If you have 100 chickens, definitely you cannot do that. But put individual chickens in a bag, make sure their head is out, and you just shake them so that the powder is all over, you know, on the skin. That's the best way to get it on the skin. Someone told me that they use like a flour duster, like with the holes. that's also a very good way to do it, but you have to really hold the bird. And of course, even though permethrins are safe for humans, there's going to be a lot of powder in the atmosphere. You know, you're powdering and you're also breathing it in. So it's better to confine the powder in the bag, and then you just shake the chickens, and you release, take another one, shake, you know, shake and bake.
And that's great, I guess, for the leg mites too, because you're also getting the legs as well as the body of the bird.
Yeah, but the leg mites are different because the leg mites are not on the surface of the skin. They're underneath the skin. And that's why I'm saying ivermectin for the leg mites, because the ivermectin is going to get in the bloodstream and it's going to go everywhere. So for the leg mites, you cannot treat them with the dust because they burrow deep under the skin. They're so tiny, they're almost microscopic. So the best way is to use the ivermectin is number one. Number two, you can use like Vaseline to try and suffocate them. And some there are some type of sulfur ointments. But the best that I've seen for scaly leg mite is ivermectin.
All right. Thank you for making that distinction. Appreciate that. Okay. So I don't see any more questions that have popped into the chat box. If you have any additional questions, you can feel free to keep putting them in the chat box. We'll hang around for another minute or so, but otherwise you can just shoot us an email and you can. So Dr. Jarra, is it okay if I CC you on the email when I send the information out so that people can contact you directly?
Oh, yeah. No problem. And okay. I will send you the PowerPoints, like in a PDF.
Excellent.
Yeah, hopefully by tomorrow, end of the day tomorrow.
Okay, sounds good. Thank you. And then I'm going to make a little bit of an advertisement for CCE Flock Talks. This is a series that we have on the, I believe it is the fourth Wednesday of the month, either from 12 to 1 or from 7 to 8. If you have already answered the survey that I'm going to put into the chat box right now, please don't answer it again. If you haven't, this survey tells us a little bit about your operation, what poultry looks like across New York State, and allows you to put your interested topics into the survey so that we can provide presentations that match your needs. So here that comes. Thank you all again for joining us, and we'll see you next time.
Thank you.
Thank you.
Thanks, Jarra.
You're welcome.
Thank you.